because other states will do it and Virginians will not benefit. So it's very critical. This is such a critical time. It's going to be settled pretty much in the next few days that your voice would be heard. Minnesota, I'm from Minnesota, and the Minnesota values are that we have two hands, one to help ourselves and the other to help others. Everybody in the community needs to help everybody else because we are part of the community. And I think that's the philosophy that we're promoting here with regard to the Medicaid expansion. That because medical
okay.
When they're laid off, they lose their medical coverage, and it's a life and death matter for a lot of people. And we need to respond to that. So basically, this is a very critical issue. We all need to be involved. We invite you to, again, it makes sense. It's good for the community, it's good for business, it's good for families, it's good for Virginia, so let's all get behind it. Thank you.
Hi, I'm Leslie Katz, and I'm an MSW student here at GMU. So we've heard about the economics of the issue and how Medicaid expansion will bring jobs to Virginia and how little the program will actually cost the state. But when it comes down to it, it's bigger than economics. This is a human rights issue. In 1948, the Universal Declaration of Human Rights was adopted by many countries, including the U.S. And in this document, it states, everyone has the right to a standard of living adequate for the health and well-being of himself or herself, including medical care and necessary social services. We need to remember that we are entitled to these rights because we are human beings. These rights are universal, which means that they apply to everyone, and they're inalienable, meaning that they can't be taken away. Expanding Medicaid will help us to make sure that people have the health care they are entitled to. This legislation is a step in the right direction to honoring the rights of all people. In plain numbers, expanding Medicaid will make it possible for 400,000 more people to receive health care. Many of us here today work with people. We serve them, whether we're social workers, teachers, healthcare workers, or students. We are advocates. We are in contact with people directly affected by Medicaid, and some of us even benefit from Medicaid. And the bottom line is that we're done with people being denied one of their basic human rights. We won't let people be turned away anymore. We elected our Virginia representatives, and they are accountable to us. They have a responsibility to ensure that health care comes first. So I urge you to get on the phone, send an email, or visit your representative. This Friday is Student Lobby Day at the General Assembly in Richmond. There are flyers being passed around about this. Again, we want to expand Medicaid now. People can't wait any longer. Brian, next.
Hello and good afternoon. Gracias por venir. My name is Brian Henriquez, and I believe that healthcare is a right. I'm here to share a personal story about how Medicaid and how it has been such an important part of my life. I've always been healthy as a child. I eat right, I exercise, and I take vitamins. That's why it was such a surprise when I was diagnosed with lung disease at the age of 7, and I still remember it so clearly. It was about 3 in the morning, and I couldn't breathe. Inhaling hurt, and I felt like I was drowning in water. My mom quickly gathered our things and rushed me to the ER, where I was later diagnosed with asthma. Back then, I was too young to understand healthcare, Medicaid, and hospital bills. But my mom understood. She was relieved because I had Medicaid, and she knew it would cover a lot of the bills and medicine I would need throughout my childhood. Medicaid helped pay for inhalers, nebulizers, and all sorts of medicines that I would need to stay healthy and live life to the fullest. Asthma is hard to live with, but thanks to the healthcare, I was able to afford all of that and live a happy, healthy life so far. While at Herndon High School, I was a member of our step team. We won the national title my senior year, traveled up the East Coast to New York and New Jersey, and without healthcare to be able to afford all the medicines I would need throughout my childhood, I can't imagine being able to compete with the other team. Unfortunately, in the Commonwealth of Virginia, while asthma will always be with me, Medicaid won't. We've been struggling for money for some time now. My mother lost her home and her business, and now that I'm 19, I'm no longer eligible for Medicaid, and I'm left without health insurance. I've been terrified to get sick ever since I lost my health insurance. I know that if I go to the doctor's office or the ER, we would have to pay out of pocket. My mom has been dealing with this for years, skipping doctor's visits when she gets sick, making sacrifices to continue to provide for her family. A few weeks ago, I came down sick. I didn't know whether it was the flu or the cold, but I decided not to tell my mom. I know that she would have insisted on taking me to the doctor's office, and I knew that uninsured, we could not afford the expensive bills. So I sucked it up and did what I had to do to get back to health. This isn't how we should have to live. I never realized how important healthcare was until I became sick without insurance. To think that hundreds of thousands of Virginians go through the same thing every day is unfair. Next fall, I plan on transferring to VCU. VCU is known for its medical school, and I have been wanting to be a pediatrician ever since. I can't imagine what it would be like to treat a child who has no insurance. To have a worried mother sit by their sick child only to receive a giant bill that they can't afford is wrong. It is scary to go through life worrying about being sick and getting sick, and I don't want anyone to have to worry. That is the main reason why I want to become a pediatrician. Children grow up with sickness and diagnoses they can't control. I know with the right care, they can live full, healthy lives, and I want to be a part of that happening. I still have asthma, and it's something I'm going to have to deal with the rest of my life. While I had health care growing up, now that I'm a young adult studying full-time and working part-time, I simply cannot afford it. And I know I'm not alone. These are hard times for so many people. If we expand Medicaid, it would give me and almost 500,000 other healthcare we deserve. Thank you for listening.
Thank you, Brian, for sharing your story, man. That was really powerful. So first, I wanted to thank everybody for coming, Virginia Organizing for putting this together, Virginia Consumer Voices for Healthcare, El Comité for coming, and who else is here? Saul, right? So first, I want to ask, Virginia Interfaith Center is here as well. First, I want to ask, can y'all hear me? Because I don't hear the crowd. Can you all hear me? Can you hear me? All right, that's good. Now, we've heard different cases from different people on why this is important, why healthcare is a right, why we need to expand Medicaid. But there's a lot we can do in these next coming days, right? The fight is happening right now. And I don't know if they really know what's going on down in Richmond. I don't know if our legislators understand the power of the decisions they're making, leaving almost 400,000, almost 500,000 people without health care, kids, low-income families, seniors. It's not right. It's not right. Meanwhile, they're making decisions on transportation, on education, on taxes, everything except basic rights that Virginians deserve, health care, basic rights. Now, I want to make sure that they do hear us at the very least at George Mason. So I'm going to lead a couple of chants, all right? The first one is going to be, don't stall healthcare for all. So after I say don't stall, I want you to say healthcare for all. Is everybody with me?
Yeah!
Is everybody with me?
Yeah!
All right, let's go. Don't stall!
Healthcare for all!
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 Don't stall!
Healthcare for
All right,
all!
that's good. That's good. That was a good warm-up. That was a good warm-up. All right. The next one is going to be about healthcare being a right. All right. I'm really glad Tansen Workers brought that sign. The truth is, we shouldn't even have to fight for this right now. A lot of states throughout the country are already providing Medicaid to the folks that are required in the Affordable Care Act. Virginia is behind when it comes to health care. So when I say we shouldn't have to fight, I want you to say health care is a right. Okay? Is everybody with me? Yep. We shouldn't have to fight. right.
Healthcare is a right.
We shouldn't have to fight.
Healthcare is a right.
We shouldn't have to fight.
Healthcare is a right.
We shouldn't have to fight.
Healthcare is a right.
All right, very good, very good. Now, Addie Alexander is going around. Wave your hand, Addie. She has a few flyers in her hand, and she has them in her hand because this Thursday, the Virginia State Senate is going to vote on a budget that does not include health care for almost 500,000 people. How does that sound to you all? How does it sound? It's terrible. Now, we need to make sure that folks in Virginia, legislators, stand up against this budget that's not for the people. So Addie is going around and she has phone numbers. Right now, what we're going to do is everyone is going to give a call to their state senator and state delegate, all right, urging them to expand Medicaid and not cut the program, all right, to expand Medicaid and not cut the program. So right now, I'm going to give everyone about 2-3 minutes. If anyone needs a phone, I have my phone. Just raise your hand, I'll find you. Addie's going to come around with phone numbers for you to call. So I want to see everybody taking out their phone and making their phone call. All right? Everybody with me?
Yeah. Woo!
I'm going to do it as well, too. Not with the mic.
No.